An Ontario mother is fighting for a special exemption for her child to receive treatment for RSV after being denied by the province. Lauren Dempsey says her 4-year-old son George has been at Toronto's Sick Kids ICU for weeks. George has a rare form of spinal muscular atrophy that make it difficult for him to battle RSV. Because of this, he qualified for a special antibody treatment but aged out of that treatment this year. Dempsey applied to the Ministry of Health for special consideration but was denied. She's now worried about what comes next for George and has set up a GoFundMe to help him get approved for treatment by his 4th birthday. For more on this, I'm joined by George's mom, Lauren Dempsey. Lauren, despite how hard this time must be for you, we greatly appreciate you being here. Thank you.
Thank you.
And we're also joined by Dr. Dina, pediatrician and founder of Kids Crew Medical, to provide more of a medical perspective here. Dr. Kulik, we appreciate you being here as well.
You're welcome.
So first of all, Lauren, I'm really sorry to find out what you're going through first off. So please, if you don't mind, sharing the latest on your son's condition.
Okay, so he's still in the ICU at Sick Kids. Tomorrow will be 3 weeks that he's been there. He was extubated for the 2nd time yesterday morning and is doing okay. Right now, it's a balancing act of medical treatment and physio to help him get better and rest. So the goal right now it's simple. It's to avoid a 3rd intubation. Mm-hmm.
And I just imagine the range of emotions that you must be going through. I, too, have a very young baby at home. If you can walk us through how the family is doing, just in terms of how you must be feeling watching your son go through all of this.
Yeah, it's unfortunately, it's not something that's new to us. RSV impacted him again back in January of 2020. But this time around, our kids are older. So we have a 6-year-old as well. And I've been home with her because I had a cold. And my husband's been doing the commute to Sick Kids every day. And I think the division is hard. And our daughter's obviously got a lot of questions, but where her brother is, that can be challenging to answer.
Yeah, what do you say to your other child? You said a 6-year-old at home. Adults, we can process a little bit. We have information we can look up. We can talk to people like Dr. Kulik as well. But for a 6-year-old, it must be terrifying.
It is. And so that's why this time around we prioritized one of us being with her. In the past, it might have been grandparents stepped in. Obviously, restrictions at the hospital were different. So she's not allowed at the hospital at Sick Kids right now because of the restrictions. So we wanted to make sure that she understood that she was a priority here. And in doing so, I think her biggest thing is, well, when's he coming home? Is he coming home? And those are answers that we don't have right now. Yeah. So having her understand that us saying we don't know is truthful. Yeah,
and that definitely, obviously difficult conversation to have, but being truthful with the child, no doubt, is helpful, I'm assuming, in the long run. Now, Lauren, if you can walk us through the reasoning you were given for George being turned down right now.
Okay, this is frustrating. So George has a very complex medical history that is well documented through Sick Kids. He was given the vaccine in January 2020 once we were given his diagnosis, and he received it from November till March every year since then. This year, we applied under a special considerations. We had a letter from the respirologist at Sick Kids outlining how important this was for him. They had his file from his previous RSV, where he was intubated. And the denial we got said that he didn't meet the underlying qualifications because he aged out of the program like we knew, and that they didn't believe if he contracted RSV that it would result in a severe pulmonary event and or require hospitalization. And that was the reasoning put in the letter from the ministry, and he's in the hospital.
And here you are. Yeah, here you are right now. So we talked about the GoFundMe that has been set up. Just if you can walk us through that and explain what you are doing to advocate on his behalf to hopefully get this treatment for him.
Yeah, it's, I apologize, it's not a GoFundMe. It's a change.org petition.
I understand.
That and my goal in that is simply to get George the vaccine for the remainder of the year once he's out of the hospital, and then following that I'll go from there for next year. But right now my goal is to get him home And when he's home, secure him the protection he needs to not go back the rest of this.
All right, so a change.org petition right now. Dr. Kulik, I'd like to bring you into this conversation in a little bit. Turn to you for some more of the medical specific questions. First of all, walk us through RSV for those who might not know and how particularly it affects kids.
Sure. And I just want to say I'm so sorry that your child is sick. I'm so sorry your family is going through that. I am not involved in this child's care, so that we're clear. I'm not involved in the decision making around who gets RSV vaccines. But yeah, RSV is a very, very common respiratory virus. About 97% of kids will get RSV at some point before age 2. So it's very common. It's ubiquitous. It's the most common viral respiratory illness. And most children, when they get it, have runny nose or cough or fever and mild viral illness. However, some children, particularly those that are immunocompromised or have severe lung disease or extreme prematurity or chronic heart disease or lung disease, those children are more at risk of getting very severe illness with RSV. And some of these children will get sick enough to require hospitalization or ICU care.
So what specifically would you like to put out there for parents to know or watch out for regarding RSV, particularly those parents with kids with those underlying conditions?
Yeah, so if your child is less than 2 and it's around the season of RSV, most typically between November and April, at least in Canada, those are the months. If your child has risk factors like they're born very prematurely or they have heart disease or lung disease, this is something that your healthcare provider will review with you, and we can apply to get the vaccine during these months, monthly from November to April. Once they're older than 2, most children do outgrow the system for the vaccine, for Synagis, for the RSV vaccine, because usually most children, if they contract it after this age, don't suffer these severe consequences. But in general, most kids that get this virus will have mild illness. However, of course, if your child is having difficulty breathing, if they're not able to talk to you, if they're of age where they're speaking, if they're not able to drink, they're having difficulty, moving air, that's an emergency room visit. Short of that, most of the time, these viruses will improve on their own. And, waiting it out with normal viral management is what we usually do.
And Lauren, my last question to you, we have just a little bit of time left. What would you like to tell people about your son and how they might be able to help in his treatment?
Oh boy, well, he's a fighter. So he was given a life expectancy of 2 and he's going to be 4 this month. So I want to make sure that we are fighting for him. And we're not failing him right now. So I would say, please take the time to go on to thechange.org, sign the petition for him. I have personally sent an email to every MP in Ontario asking for them to review his specific case. And if there's parents out there who were denied and think that they should qualify for the vaccine, please speak up before your child gets RSV. Because with George, we were too late.
Well, Lauren, all the best to you and your family. We wish George all the best. Thank you so much for your time. Appreciate it.
Thank you.
And Dr. Kulik, thank you for your insight in this conversation.
You're welcome.